Thank you, Lauren. We're waiting. This is going to begin in just a few moments. You will see it all live right here on CNN. As we wait for the hearing to get underway, let's talk about this with our chief political correspondent, Dana Bash. Also with us this morning, Dr. Anish Mahajan, Chief Medical Officer for Harbor UCLA Medical Center. Good morning to you both. I'd like you to listen to this from Dr. Fauci last night, just about where this country is and what needs to change. Here he was.
We need to put out all the stops to get it down to baseline and to keep it there by doing the things that we've been talking about and that I've been talking about consistently. If we do that, Sanjay, I think we're well towards seeing this under control. If we don't, then we really can't make a prediction about how long this is going to last.
Dana, that's really important. A candid response there. It's impossible to tell at this point unless our prediction changes when this is going to subside until a vaccine. Should we expect more straight talk today from Dr. Fauci? But what about from Admiral Giroir and the CDC director, Dr. Redfield?
Well, let's hope so. I mean, they are under oath, and they are going to be doing what it's very clear all three of them understand is their really important duty to participate in the oversight process from Congress. We've heard a lot from all of them, but particularly from Admiral Giroir, the question that I have is about why we are where we are right now. I mean, it is August tomorrow. Why are we not so much further along on testing, which is such a key tool to reopening society, schools, the economy, everything? And there have been so many recommendations that we've even seen from several medical associations just this week, Poppy. Basic ideas on how to do that with regard to expanding testing, expediting testing, which is the most important thing. It's really the speed or the lack of speed that this is happening across the country. So that is really where he is going to be, I think, pressed, in addition to so many other issues that are still unanswered. And it's really remarkable that we are at the end of the summer, Poppy, and this all started in March. And we're really no better off, and in some ways, it's worse.
You're completely right. As we look at the death toll on the screen, 152,075 Americans perishing from a disease that the administration, the president in the early days dismissed as something that was just going to vanish. Doctor, to you, as we look at the ranking member, Steve Scalise, they're the chairman of this select committee, James Clyburn, they're going to get started in a moment. But Doctor, the fact that we heard Admiral Giroir, who is the testing czar, and who is, the front person on improving the testing crisis in this country. The fact that yesterday he said it's not acceptable where we are, the delays. He said that should not be acceptable. How significant is that, given how much he has defended testing in this country?
It's very significant. Dana is exactly right that in the absence of timely testing and testing results, we will not be in a position to reopen businesses and certainly not safely reopen schools, particularly in places where there's a whole lot of virus in the community, which is broadly across the United States. So I'm very heartened. Many of us in the medical community are looking to today's hearing to see the truth be told yet again. Dr. Fauci has consistently told the truth in his entire career and throughout this coronavirus pandemic. We need to heed what he is saying.
Absolutely. Dana, how important that we're seeing everyone that I've seen on camera so far in that room wearing a mask, obviously being mandated there in the House, but it's very, very significant and sends such an important message to the American public. Before this gets underway, I would like to play also for you something else that Dr. Fauci said, because the head of Operation Warp Speed, of course, working toward a vaccine, Moncef Slaoui, said just a few days ago, yesterday, he would not be surprised if it turned out that a vaccine is 90% effective on this virus. Here's Dr. Fauci on that.
I mean, that's obviously a very optimistic estimate. We all hope it's going to be that way. I'm not sure it'll be 90%, but I think it's going to be reasonably good.
Doctor, you, just what should people think? Is there any guarantee a vaccine will be 90% effective?
It is very optimistic. We don't yet know. What we know so far about vaccines with phase 1 and phase 2 trials is encouraging. We are seeing that the vaccines have largely been safe in the limited amount of time in which they've been tested. They've mostly been tested healthy people under the age of 55. All of that said, they have had antibody responses and other immune responses. We have seen the vaccine work in monkeys. Monkeys have been able to clear the virus from their lung passages who've received some of these vaccines. But the real question will be answered. How effective is this as we start these phase 3 trials, which have started this week? We will have tens of thousands of people around the world enrolled in these trials, and it'll take months to see how many of those people who actually got the vaccine were protected from it compared to the group that got the placebo. Only after those data are in can we even begin to say how effective the vaccine is going to be. No one knows yet.
Dana, I think I'd be remiss not to note the fact that this critical hearing on the health of Americans comes on the same day that Congress has failed to come to an agreement